Hey everybody, this is video 3. So the reading this week was actually pretty interesting. Um, Comparing ethnocentric versus being culturally real, if you will. And basically, my workplace is very ethnocentric. Mostly because there is a lot of RN versus LPN. There's definitely the feeling that RNs are more important and are better. I think every job I've ever worked as an LPN has basically had that. My place right now, I do home care. So I travel to different people's houses throughout the day and provide whatever care they need, being setting up med boxes or wound care type stuff. LPNs are usually seen as having a limited scope of practice, shorter educational requirements. You can get an LPN degree faster than you can get an RN degree. And there's perceived differences in responsibilities and authority. LPNs are considered to be task-oriented, where RNs are perceived to be the ones who use critical thinking. Where culturally being real, you understand that different cultures have their own values and their norms, and they're not inherently better or worse than any others. Do I think leadership at my particular organization addresses ethnocentric tendencies? Absolutely not. They will literally, in meetings and in text via like email or, private chats and whatnot, say nurses and LPNs. So not even feeling validated by the fact that LPN has nurse in the word, or in the title, if you will, is, it's frustrating. And it definitely has like a negative connotation, where most LPNs I know are very hard workers and sometimes know more than people who have higher degrees. So I feel like my organization could start appreciating LPNs, not just, we appreciate what you do every day, but, in action, considering us to be real nurses. LPNs were actually brought to be during the World War II situation when the RNs were going into the military to serve. So they needed people here stateside to be nurses. And that was the invention of the LPN. So, just being appreciated, in any kind of way other than just thanks for being here would be nice. I know for myself personally, I see 7 people a day, and sometimes multiple times I see that person in a week. And there are instances in which I'll write a long, detailed note stating my concerns for the patient. Either their wound is deteriorating or their blood pressure's been too low and they've lost a lot of weight, and we should probably reevaluate, the blood pressure medication they're on. And my manager will immediately go to the RN that I work with and ask for her opinion, which I think is hilarious because that RN hasn't seen that patient in like 3 weeks. So how is that RN going to know anything, in my line of nursing? So it's just like, trust me that I'm giving you accurate information. Trust me that I'm smart enough to say, this patient's lost 30 pounds and now is bottoming out in their blood pressure daily because they're still taking the same amount of lisinopril they were taking before they lost the weight. I mean, that's just common sense to me. Let's see. in regards to also what I learned and thinking about the whole situation, is it's interesting because nurses are known to be non-judgmental, culturally sensitive, culturally knowledgeable. Like, we're responsible for knowing which types of cultures wouldn't want a blood transfusion. We're not supposed to give our opinion. We're not supposed to have biases or prejudices. We actually have a code of ethics that we're supposed to be following. So out there treating patients, we're culturally real, but how we treat each other is ethnocentric. So we treat patients then better than we treat ourselves. So hopefully with that recognition, it's something that I can address to a manager at some time, and hopefully see there's things that we can do. All right, that's it. Talk to you guys later. Bye.